ECHS, the ECHS insurance, and I think government employees get CGHS insurance, right? Even if they are retired, but even that is ridden with bureaucracy and a lot of paperwork about claims. Nothing is straightforward, even if it comes to government insurance in India. Um, but at least there is some insurance there. Most people don't, right? So, rising global rates of disease, cancer. I mean, COVID is, yeah, okay, but there are so many other problems. Hypertension has become a real problem. Cancer, diabetes. It's becoming a big impact on low and middle income countries where medical bills can make you bankrupt, right? You'll have to sell your house, land, whatever, quickly deplete all the limited resources that poorer families have. Fourth one is an important one, expanding access to medicines. So although many in the world take access to medication for granted, medicines and vaccines are not an option for almost 1/3 of the global population. I mean, of course, India has a huge generic pharmaceutical base, but it's still out of pocket, right? Nothing is free. Even if you're admitted in a government hospital, medical bills. I mean, you still have to go to the government pharmacy and pay money and actually buy the medicines in most cases. So the challenge of expanding access to medicines in areas where few, if any, healthcare products are available, that it's a challenge, and that also includes combating, especially when you have generic medicines. Combating substandard and mitigation medical products is really difficult. I'll give you one simple example, right? My mom always says bring paracetamol from the UK. The paracetamol in India doesn't work. It's the same, it's the same thing, paracetamol, both the countries, okay? Of course, paracetamol is generic here as well now, but you can buy it in the supermarkets, but it works. And she's like, the Indian one doesn't work. You bring it from there. So every time I go, of course, every store offers me a limited number of paracetamols. I can only take 2 packets. So I go to about 10 stores and buy 20 packets and then take it and give it to my mom. I mean, it's a basic medicine, right? Even that is spurious and substandard in most cases in India. So that is not very helpful. So in addition to putting spurious medicines, imitation medical products, in addition to putting lives at risk by failing to treat the patient's condition, these products can undermine confidence in medicines and healthcare providers. I think confidence is important when it comes to healthcare and medicines. Fifth one, stopping infectious diseases. Yeah, COVID is the case, but infectious diseases continue to kill millions of people. Most of them are very poor. It's unlikely to change the situation in the near future because, I mean, this is my perspective. Because COVID became a global problem, it affected rich countries. We went and got a vaccine in a year. Take Ebola. No one bothered when Ebola came out because it happened largely in Africa. It took 6 years to get a vaccine out, right? And that is a problem. Who cares about the problems of the poor? Okay, suddenly it's a rich man's problem. COVID is impacting the rich. Yeah, let's try and solve it. But HIV, tuberculosis, malaria, it's all poor man's problem. No one is going to put so much money to solve malaria, right? COVID, oh wow, 1.5 years we kind of came up with vaccine, hundreds of pharmaceutical drug companies working on a cure. Yeah, but malaria, it's existed for ages. We still don't have the perfect cure for malaria. Right? Same thing with tuberculosis. We still don't have the perfect cure. So there's more political will is needed for these things. Greater funding, political will is needed to actually stop infectious diseases. Preparing for epidemics, more investment is needed. Airborne viruses like COVID or malaria can spread quickly, with potentially devastating consequences. And what is happening is there's more time and resources that is spent reacting to a new strain. So, like COVID, new Delta variant, Alpha, Gamma, Beta, whatever it is, rather than preparing for future outbreaks. And it's not a question of if a dangerous virus will come out, but when it will actually come out. So preparing for epidemics is the sixth one. The seventh one is protecting people from dangerous products. This is very, very important. Food insecurity. This was some research I did as part of my agri-entrepreneurship project. Many poor parts of the world face malnutrition and food insecurity. They haven't built resilient food systems. So, when there is crisis, there is no buffer. Okay, but at the same time, you see global obesity levels and diet-related problems are on the rise. So, we need to rethink what we eat, reduce the consumption of food and drinks high in sugar, salt, and harmful fats. Right? And this is also related in a way, right? Okay, to, like, people were talking about packaging and plastic earlier, right? So we're consuming more processed foods, and most of them come packaged, isn't it? That's also creating, instead of focusing more on making our food systems more resilient, okay, and reducing food insecurity globally, okay, let's take India for example. Okay, this is something I really find disturbing to an extent. So, water. Why does it have to be packaged everywhere? It's created in industry, right? Packaged drinking water, because we haven't built the infrastructure to supply point of use fresh drinking water, that you can just take off the tap. Of course, we have to put all sorts of things in our houses, UV, RO, whatever it is, to get good water. That's one thing. But the other thing is we have too much of packaged drinking water. That's also creating packaged waste, isn't it? So it has an, if we solve, but again, that's only for the people who can afford it, the packaging. But most of the people can suffer from not so good clean water. Okay, and that also creates disease, isn't it? If people are not getting high quality water. Yeah, on the one side you've created plastic waste, on the other side you haven't built the infrastructure to supply clean water. Okay, we haven't really focused too much on these basic things. We're trying to create more jobs and trying to build a more industrialized economy, but we think, okay, we build an industrial economy that will create the revenues, and then we can go and solve the basic problems. I think that's the thinking we have at the minute. We're not thinking, let's solve the basic problems first, and then once the basic problems are solved, but again, start small, take small steps and solve the basic problems. Once the basic problems are solved, you have a very healthy economy. So you have a very healthy population. The well-being of the population is taken care of. Then they'll be more productive, and there'll be more growth, economic growth, and that will more kind of reasonable economic growth rather than crony capitalism and rampant growth and unregulated growth. Right? There'll be more people will be more happy and satisfied. So when people are more happy and satisfied, the growth won't be rampant, and I think it won't be dog eat dog kind of situation. It won't be cutthroat competitive capitalism, right? So I think the well-being of people is more important, and the well-being is taken care of, then other things fall in place. That's my opinion, right? So again, I've kind of gone off track here, but that's my tendency. So apologies, but I'm trying to make a point here. The point is, entrepreneurs need to think of solving basic problems. The eighth one is investing in the people who defend our health. So health workers are in short supply the world over. Um, yeah, I mean, India needs a lot of paramedics, to be honest. Um, Sustainable health and social care systems depend on well paid and properly trained staff who can deliver quality care, right? Uh, Doctors don't want to work in villages, right? Most doctors would prefer working in a large hospital in a city. Medical education has become so expensive, like I'm sure it costs 1 crore or I don't know more than that to get your medical degree. And obviously, if you're spending 1 crore or 2 crores on getting a medical degree, why would you want to work in a village, right? Um, so by 2030, according to the WHO, there will be a shortfall of 18 million health workers, mostly in low and middle income countries. So we need more paramedics. Obviously, if doctors are not willing to go into the villages, and we have kind of created this private medical education situation where medical education is becoming so expensive, we need an alternative solution, right? So we need to invest in people who defend our health. The ninth one is keeping adolescents safe. Every year, more than 1 million adolescents aged between 10 and 19 die. Road accidents, suicide. Yeah, suicide is really, really growing. Domestic violence, HIV, respiratory conditions. They're all premature deaths, completely preventable. I mean, I was actually watching yesterday on Netflix. I'm sure some of you have already seen it, Quota Factory. And when I was reading about quota and all this competitiveness is creating a lot of problems among the 16-year-olds and quite a number of suicides in quota. So we are failing our young adolescent population, who are dying of premature deaths that are preventable. So policymakers, educators, health practitioners need to promote positive mental health among adolescents, um, prevent illicit drug use, alcohol abuse, self-harm. There needs to be a lot of awareness campaigns, and understand causes of adolescent fatalities, right? And finally, the last one is earning public trust. So delivering safe, reliable healthcare to patients involves gaining their confidence, and this can be undermined by rapid spread of misinformation. This happened on COVID, right? During all the fake news that happened, anti-vaccination, anti-vaxxers. It's led to a lot of increase in deaths, and these are preventable diseases. If you had got the vaccination, you wouldn't be dying. And social media can be used to spread reliable information and build public trust in healthcare. Community programs. In fact, our own politicians are spreading a lot of fake news. Right? How do we stop our own politicians from stopping fake news? So, community programs are another way to boost confidence in healthcare and prevent the spread of diseases. And make people use vaccinations as well. Okay, so that's another way of thinking about earning public trust. Now, what I want to say is, okay, having discussed all the global challenges, what I want to point out is there are two things that one needs to keep in mind. There is inequality and there is inequity. Okay, sometimes these two are confused with each other, and they're not interchangeable. Inequity refers to unfair, avoidable differences arising from poor governance, corruption, cultural exclusion, while inequality refers to uneven distribution of health or health resources as a result of genetic, or other factors or the lack of resources. Okay, so I might be genetically more vulnerable, to someone else, right? With regards to COVID, so that's inequality. But obviously, I need to get the same opportunity as someone who is more genetically strong. Okay, but inequity is a result of failure. It's poor governance. It's corruption. Inequity invokes unfair and it's a moral outrage, basically invokes moral outrage. It is unfair. It is indefensible. It's a result of human failure, um, giving rise to avoidable deaths and disease. So if someone doesn't want to take a vaccine, that's because he's less educated. So how do we give him a high, more education, a longer ladder, a taller ladder, so that he'll go and take the vaccination? So we need to put more effort into that person, right? So social justice, just creating an app, Arogya Setu app or whatever it is, Aptamitra app, and asking only the haves to download it, is not equitable solution. How do we get the poor people also to get vaccinated when they're not, when they cannot, when they don't have a decent phone and cannot put an Arogya Setu app, right? So social justice is literally a matter of life and death. Inequity is often measured in terms of the inequality of health or resources, which is appropriate, where one might reasonably expect equality. So, in the rich countries, for example, in the UK, and we have NHS, for example, in England. Okay, NHS means 95% of people go to NHS. Very few people have a health insurance like Bupa health insurance. Most people, 95, well, everyone has NHS access, including the ones that have private health insurance, can go to NHS at any point of time, right? So that's, everyone can access those health resources. Men, women, any race, whatever, any age, anyone can access those healthcare resources. But okay, everyone, that's equality, right? You've created the NHS, you've created equality. But when, even in the UK, when some of the poor people who live in council flats, who live on benefits, okay, who if they don't go and access healthcare facilities as often as I would do. So, for example, I would go every 6 months to get myself fully checked up from my local GP. It's completely free. I'm 40 plus, right? And every 6 months, I check all my cholesterol, vitamin D, whatever levels, and any small problem, I go and approach my doctor, my GP, and take appropriate precautionary measures. But if it was someone in the council flat living on benefits, they won't do that, right? Because I have slightly higher education level, I'm a bit more cautious. So how do we give a higher ladder to someone who's living in a council flat so that they would go and access the GP and get themselves regularly checked? So that's an issue of equity. It's not, both me and someone living in a council flat have equal access to all the NHS facilities. The other person has, but the equity is different. It's inequitable. I have more education, he has less education. He needs to be given more education so that he will access the GP facilities more regularly. Okay. But in India, it's a completely different situation. There is inequity, there's huge corruption, huge governance issue, but huge inequality as well, right? Everyone doesn't get the same access to healthcare. So with the primary healthcare facilities are not great in India. The government healthcare facilities are not great in India. We all know that. So within every population, there are differences in health status, and it would be unrealistic to expect that health or health resources would reach the same level in poor countries as they do in countries with greater resources. Okay, that's unrealistic. We need better solutions. We need more innovative, creative solutions. In the case of India, it's a huge country, huge population, culturally diverse, right? It has its own unique challenges. So you can't have the NHS kind of system that works in the UK and put it in India. It's not going to work, right? So, but the other way to think is, we're all global citizens with a human right to health. There must be at least universal access to basic health services. Basic health services. If things are preventable, provide that, and it can be done at a low cost. If preventative health can be provided at a low cost, then those services must be provided free of cost. Immunization programs have been hugely successful in India, but the same thing needs to be shifted to other things that are preventable. Diabetes, yeah, it has some genetic effect. It can be prevented. Hypertension can be prevented. These are becoming some chronic problems in our society today. So life expectancy varies from more than 80 years in some rich countries to less than 45 years in countries where health resources are lacking, governance is weak and often corrupt. So within countries, life expectancy for disadvantaged groups is typically 10 or more years below the average. Yeah. Even if you have diabetes but you're rich, you might survive more than someone who's poor. Okay. So those covered by, like in the UK, we have National Health Insurance Scheme. They have access to health services more or less equally once they are in the system, regardless of gender, ethnicity, religion, whatever. But the ability to benefit from these services is definitely subject to individual autonomous decision making, socioeconomic circumstances. Because I'm educated, I made conscious decision to get myself checked every 6 months. To ensure health equity, extra resources are needed to assist those perceived to be disadvantaged to make use of the same service provided by the health scheme. So, one solution could be that, I think in that respect, the Narayana Hridayalaya, right, the Narayana healthcare system has done fairly reasonably well in India in terms of providing. What I hear is they don't deny anyone who comes to their doorstep, right? We have some great initiatives like the Aurobindo, Aurobindo healthcare system as well. The Narayana and the Aurobindos are quite interesting examples of providing equitable access to healthcare for everyone. I mean, the rich get treated in Narayana, but also the poor are not denied healthcare, and they may not get the luxurious beds, or they may not get single private rooms, they may not get air conditioned rooms, but they get the health facilities. They get the same health facilities. They may not get the luxury that the rich people enjoy, but they have access to the same healthcare facilities. So, it could include what I'm sure what the Aurobindo Healthcare does is, like, for example, for the eye camps, right? They provide travel assistance. So they take people in they provide travel so that they can be taken to these eye camps or for surgery or whatever. And they also provide accommodation for them, isn't it? So obviously, there will be health inequity when those in higher income group can access private healthcare services in addition to the national health scheme. Okay, so my mom, for example, can go for ECHS or she can go for private healthcare because she can afford it, right? But there is health inequality as well as an inequity when comparing health services and outcomes across the world. Much of the difference is due to uneven distribution of disposable wealth within the country, as well as between countries. So some of the apparent inequalities are also religious or societal. The anti-vaxxers, for example, a lot of it is my body. Kind of, it's by my body, only I and my religion says not to take vaccine. So not health inequalities can be solved by simply throwing large amounts of money at it, although money used at the right level can help a lot. So I'm just going to talk about a few more things about determinants of health before posing the challenge, and then we'll see what solutions you all come up with. So income. So what are the determinants of health? Income determines people's ability to buy health improving goods, from food to gym memberships. So I'm a gym member. I go swimming. I do studio cycling, whatever. But managing on low income is a source of stress. And emerging neurological evidence, suggests that being on a low income affects the way people make choices concerning health affecting behaviors. So children from poor households are many more times, likely to experience severe mental health problems than those in the highest fifth, right? Housing is a problem. Poor quality, overcrowded housing, um, it's associated with increased risk of cardiovascular diseases, respiratory diseases, and it's true that if you live in overcrowded shanty areas, obviously there's more increased risk of diseases. Environment is a huge problem. Access to good quality green space is linked to improvements in physical and mental health and lower levels of obesity. When I was in India, my mom lives in a nice apartment in Bangalore. It's a nice campus. There are 1,000 families, I think, but it's a huge campus, and there's a nice running track, place to cycle. So I used to go cycling every day, and I used to go running every day. um, the access to that good quality green space is important for physical and mental health. Levels of access are likely to be worse for people in deprived areas, right? Shanty towns, and for areas with higher proportions of poorer people. And exposure to air pollutants, can cut short many lives. And mega cities in India, if you don't have that green breathing space around your house, you will be exposed to air pollutants all the time. So exposure has been linked to both deprivation and ethnicity. In the UK, it's obviously linked to ethnicity, but for example, in even in Leeds, where I live, there are areas which are gentrified, and there's hardly any trees there. Okay, so and those are people where mostly immigrants and ethnic minorities live, and they're very deprived areas. So and the healthcare is really bad. There's more pollution, and healthcare is really bad in those areas. Happens when within rich countries, um, even in yeah, I mean, it's not just limited to poor countries. It happens even in rich countries. Transport is the other one. Those living in most deprived areas have 50% greater risk of dying in a road accident compared with those in the least deprived areas. Okay. And obviously, children in deprived areas who are playing on the roads, okay, might be killed more often than wealthier people who are in their big apartment complexes, and all the recreational facilities are within those apartment complexes. Right. So children, yeah, in deprived areas are more likely to be killed on roads, or at least more likely to be hit on, at least maybe casualty rather than a fatality. Education, on average, if you have a university degree or you are more educated, you can expect to live longer. Okay. Work, unemployment is associated with lower life expectancy. That's why we're talking about at least the basic health coverage, and we need basic universal income for people. So the also there are other things. And there was one thing that was posed at the beginning of today's lecture. Okay, if we take plastics jobs away, it's still ringing in my mind. Let's create another industry where they can go and work. But the thing is, do we want to keep people in hazardous jobs? Okay, do we want to build a manufacturing economy? And the quality of work, including exposure to hazards, is more for the economically, is the quality of work is bad for people within the economically lower stratum of the society, right? And they're more exposed to hazards. So we need to rethink well-being and work within the society as well. And that's why I really think universal basic health coverage, universal basic income, going towards a service-based economy, thinking about solving the basic necessities of life rather than consuming is what is needed. It will create more opportunities. Definitely, it will create more entrepreneurial opportunities. But we need to solve the basic problems of life, basic problems of people, and we haven't given so much attention. Rather, we are building a capital-based economy, which is not going to solve a lot of people's lives. people's problems. Okay, so I'm going to pause there on the health challenge, but pose a question to the audience. And I think let's have a little bit of thinking exercise here. And this is a challenge, a real challenge. About 62% of people in India do not have health insurance. Most households shoulder the burden of healthcare costs with out of pocket expenses, which is about 59% of total health spending. And 1 in 5 households experience catastrophic or impoverishing health expenses, and they have to sell their land, whatever, property. So I want to pose this question back to you all. How can healthcare access be improved in India? We've discussed all about equity, inequality, and all that. So how can healthcare access be improved in India? Any suggestions, any ideas from people in the room?
Sir, I feel, as you mentioned, all these problems are rich person's problems. To be able to discuss about it, and I think it's the elite group that is discussing about the solutions of these problems, and we're privileged that we have the time, and in monetary terms also, that we can discuss about these problems and think of the solutions to these problems. So I feel as you mentioned, the lack of doctors, 1.8 million doctors in the near future by WHO. I feel increasing the education access of the class of the backward classes of the unprivileged people would help, and creating like reskilling camps, as one of the students mentioned here, also would help, and like working on the principles of social justice, that is to increase the access to the resources of the unprivileged people, increasing their participation, and including a diverse group of people than only focusing on the elite class. And also I would say like targeting on the intersectionality of the problems, I guess, will help the most, like intersectionality of health
Mhm.
and environment, as you
Yeah,
mentioned, intersectionality of the housing problems and health, I guess, would help.
yeah, absolutely. No, you're spot on there, Dolly. And yes, I think does anyone think we can? Okay, so medical education is very expensive in India, right, at the minute. Um, do you think do we need more doctors or do we need more paramedics? That's an important question. Do we, because if we okay, we'll create more paramedics. Fine, I've said that we need more paramedics, but people still have to go and treat it in large hospitals within the cities today, isn't it? Even if you're in a village, okay, the paramedics can do a little bit of job, whatever the basically trained nurses can do a little bit of job. But when it comes to complex diseases, you still have to go to the hospital, right? Okay, so again, I'll add on to the reflection. So does it mean that we need more frugal medical education or something else needs to be done here? There was an answer in your own Dolly, the answer was actually in what you just stated.
Yes, I guess.
Someone else wants to speak? Yeah, who else? Someone had raised their hands. Dolly, you want to go ahead?
Yeah, I guess focusing um, on the paramedics on the short term, and then focusing on creating experienced and well trained surgeons or doctors in the long run would be beneficial.
Yeah, yeah. But a lot of it may be preventative health, isn't it? Because you don't have to go into a hospital to get treated by a doctor if things can be prevented in the first instance, right? It's if water can be improved, infectious diseases, if you can have more clean water in more sanitation, more hygiene, even within rural areas, which can be driven by the local healthcare professionals, right? And if those, and with in collaboration with the local communities. So if that can be facilitated by the government, right? Then there'll be less infectious diseases, and you won't, and there'll be less healthcare, burden on the healthcare system, so people don't have to go into the towns or cities, into the hospitals nearby. Is one way of thinking about it, and that actually does point to a little bit about, um, again, there is a link here, in my opinion, and the link here is to do with circular economy practices. It's again how food is produced. It's everything is linked up here. In my opinion, how is food produced? Okay, so at the minute, what do we do in our food? We When we do agriculture, we put a lot of chemicals in the food, isn't it? And there's a lot of we use a lot of fertilizers, we use a lot of pesticides, we use biocides, whatever it is. We use so many chemical stuff in our agricultural practices today. Where is all that going to end up? It's going to end up in our water resources, obviously, right? So, and that pollutes groundwater, that pollutes fresh, rivers, whatever, lakes, aquifers. It pollutes all our water resources, and that causes diseases among, a lot of agriculture is still a rural activity, right? And that causes a lot of diseases. That's an environmental problem. You don't need doctors to solve the problem. It's preventable. We just need better agricultural practices to actually solve a lot of the healthcare problems in our society and community today. Yes, Dolly, you have raised your hand.
Yes, sir. So, on the circular economic model point of view, I would say the cost of the circular economic model, in terms of efforts, time, human resources it requires, and money also, it is a problem because firms wanting to switch to the circular economic model can't because of the lack of these few resources.
Yeah,
So that is again making countries like Africa, as we discussed in the session before the break, is making countries like Africa the dumping grounds of America and Europe. So that is
yes,
increasing the problem. The out of sight, out of mind mentality is again increasing the problem rather than helping in reducing it.
absolutely. Yeah. I mean, if you think about it, the largest fruit and veg market in Africa is next to the largest electronics dumping ground. All your food is going to be contaminated, isn't it? With all the pollutants in the air. So that's not healthy. You're right. I think it's all related. I mean, I was also thinking about stubble burning in northern India, right? Um, I'm sure there are other alternative solutions to stubble, which are more circular. You don't have to burn it. And that creates health problems, not just within cities, not just Delhi. It creates problems even among the rural villages who are, where this stubble is being burned, right? Um, so we need to facilitate better solutions so that more productive use can be made of these agricultural waste, or they need more diverse. I mean, having research in agriculture, I think it's all food, water is important for healthcare. I've not picked on food and health specifically within our discussions here. I've just picked on health, and then I'm trickling down into food actually. But food is so important. Food security, producing food in the right way is very important for maintaining the health and well-being of society. Then we won't need all these expensive big hospitals, and we don't have to worry about how much money you're going to spend when you're critically ill, because people in general will the population in general will be a healthy population, right? And but the industrialized capitalistic society, we waste a lot of food. We want cheap food. Most of us want cheap food, and like UK, for example, among Europe, we have the cheapest food. Europe is a bit more mainland Europe is a bit more expensive than the UK. We've got used to cheap food here. In fact, processed food is much cheaper here than in India. Orange juice or whatever it is that comes packed is much cheaper. But in general, we've got used to cheap food. I mean, globally, we've got used to cheap food, cheap processed food. Uh, and of course, as a result of cheap food, the farmer is also not benefiting. So if the farmer is not benefiting, then because the middlemen make a lot of money and the farmer is not benefiting, then he can't pay for his health and well-being. That's the majority of India's population, the farming population. They can't manage their health and well-being because they're not getting the appropriate food, appropriate returns on their produce. It's kind of all interlinked. So, but if also if they are using chemicals to cater to cheap food, produce food in large quantities, improve the yield by using chemicals, right? Then their health and well-being is also impacted. So it's a double situation for them, it's a double problem for them. One, they're not getting enough returns. Two, they're using chemicals to get higher yield and polluting the water, right? So as a result, the health and well-being is being affected. It's not about how can healthcare access be improved. I think it is how health and well-being of the population. I posed this question, but it's a wrong question to ask. To be honest, I think the reflection is the real way to think is how can health and well-being of the population be managed, and how can we improve our governance so that we have a healthy and population that is that is not constantly exposed to harmful environmental factors. Right? That's the way we need to think about all the healthcare problems in India are related to environment and pollution. To be honest, most of it is related to that, and it's related to access to processed food. The more processed food, the more things you eat, you get diabetes and hypertension and other things. All the Zomatos and all the, it also, it's problematic for me when I go and I get a bit disturbed, because I've heard my friends complaining how much waste Zomato creates. And there's a lot of food waste that is happening as a result of this fast delivery of food, and people have got used to this convenient lives, and we want cheap food delivered at our doorsteps, right? And all of this is creating a lot of waste, and of course, people are developing hypertension, diabetes as a result of these problems as well. So there's, if you really think about it, it's all kind of interconnected. It comes down to how we produce our food in a more environmentally friendly way, in a more ethical way. How do we produce food in a more ethical way? That's what it all is boiling down to, in my opinion. Any other thoughts from students? Everyone is very quiet. Please do speak up. Okay, if no further thoughts, Dolly, have you got any final thoughts before we move on to the next section?
I would say the point where you talked about subtle, the burning of the crops. There is this startup because I'm from Delhi and I know how severe it gets because of the problem. Even after government taking measures, it's not working. I know a startup who is working on this problem and takes the leftover of the farmers, or I guess I'm not getting that word right now, but they take the leftovers from the farmers and then they convert that into paper plates and paper bags and stuff.
Yeah.
So that is like a nice solution, like the right way to approach it, I guess.
Yeah. There are other things you could do with stubble agricultural waste, but it is. I think again, this is where my uh, thinking goes. Okay, I don't know if I'm think again. I'm an academic, and if people may accept my thinking or people may not accept my thinking, that's fine, because but I want to have an independent thinking. And my thinking is this: that if you create paper plates and everything else, you are still, or you can do other things. You can create biofuels out of it. One of my students had a project idea where the idea was, okay, let's take all this stubble waste and create biofuels out of it, and obviously it will run your vehicles. And if you make plates, again, it's consumption based. That's one way of thinking. You are still thinking in terms of fast moving consumer products or the industrial economy, right? But if you think of agriculture itself, you don't have to get rid of this stubble, because some of the waste needs to be there to manage soil quality. The soil, we have depleted our soils, right? Through chemical agriculture, industrial agriculture. The soil has a lot of microbes, it has a lot of microorganisms that keep the soil healthy so that you can grow any number of crops. You can have crop rotation. Now, when you take all these agricultural waste away, the soil is not getting fertile and the microorganisms are not sustaining. Okay, which means you become more dependent on these seasonal crops, which need more chemical, industrial agriculture, more fertilizers, more pesticides, whatever. But if you have biodiverse agriculture, if you have more wild species of plants around your seasonal crops, you invite bees, you invite birds, right? And these wildlife species, the flowering wildlife species can improve the soil quality, right? And there'll be more microorganisms in the soil. And automatically, you'll have better yields for your crops. You know, it is a valid thinking, but how difficult or easy it is to implement. Um, uh, you know, uh, because we got so used to this industrial agriculture and the supply chains are all built around it. Transforming our systems is a big challenge. Okay, so how do we take small steps and go towards more biodiverse agriculture? And there are some experiments happening within the UK, but there are experiments happening even within India. Because I went to one such small farm in outside Calcutta. It's called Tuna Organic Farming. They do a very nice integrated farming, where there's a nice pond, and there's chicken above the pond, and the poo of the chicken feeds the fish, right? And then there's a lot of hyacinth and all that grows in the pond, and they use the um, uh, you know uh, they use the hyacinth to actually compost it, and then it becomes manure, and then they grow other crops, mustard and other crops around the field. So it's kind of a nice circular economy. But obviously, it's not biodiverse. Biodiverse means that you also grow a lot of flowering plants, wildflowers, and then the bees come in, and the flowering plant, the plants, all these biodiverse holds the soil and the microorganisms, because the microorganisms are in the roots, right? So that would be a solution, but that's a very challenging solution. The easy solution seems to be, let's go and make paper plates, or let's make biofuels. Those are superficial solutions, though. But the long-term thinking would, oh gosh, our agricultural system is industrialized, heavily chemical dependent. How do we change these agricultural systems? How do we change? Then the entire, if we can change this, then the population will be more healthy. Will be better. That's another way of thinking, right? So, Dolly, does that answer your question? Or
Yes, sir. Totally.
yeah,
Yeah.
okay.
Thank
Right.
you.
Okay. So let's move on to the next one, which is I want to talk about education next. Okay. So education. Yeah, education crisis. Being in school is not the same as learning. So education crisis. The name of the dog is Puppy. It's a simple sentence, But in Kenya, Tanzania, Uganda, 3 out of 4 third grade students do not understand it. In rural India, 3 quarters of third graders cannot solve a 2 digit subtraction problem such as 46 minus 17. And by grade 5, half of them in India still cannot do the subtraction. So the world is facing a learning crisis. India is also facing a learning crisis. While countries have significantly increased access to education, I mean, obviously, education is universal in India, but I mean, I have this whole issue about private schools, and even in villages, in rural areas, I have this whole issue about rampant increase in private schools. But while countries have significantly increased access to education, being in school isn't the same as learning, unfortunately. So worldwide, hundreds of millions of children reach young adulthood without even the most basic skills like calculating the correct change from a transaction. We were talking about why people don't understand, why people don't go to a doctor or whatever. They can't understand a doctor's instruction or a leaflet, right? Um, Understanding a bus schedule, let alone building a fulfilling career or educating the children. So education is at the center of building human capital. Even if you want better health in the society, education is important. If you have better education, then farmers will know what to do with their land. They will know, okay, we shouldn't practice so much industrial agriculture, right? So the latest World Bank research shows that productivity of 56% of the world's children will be less than half of what it could be if they enjoyed complete education and full health. Okay. So delivered well, education along with human capital generates benefits to individuals and societies. For individuals, education can raise confidence, self-esteem, furthers opportunities, and for a country, it helps strengthen institutions within societies, reduces poverty, improves healthcare, improves food security. So all these are all the benefits of good primary education. It's all connected. This is the ground problem. This is the basic problem. Solve it, all other problems will be solved. So education remains it's inaccessible for millions of children around the world. 72 million children of primary education age in the world are not in school. And what are the causes? There's marginalization and poverty. For many children who still do not have access to education, it is because of persistent inequality and marginalization. Just yesterday, I was watching a Telugu movie because I speak Telugu at home. It was on Netflix. It's called Malaysian, and this is a real story. It's about this guy who invented a weaving machine that really improved the productivity of traditional weavers in Telangana. And because of the traditional weaving, they were facing a lot of shoulder problems and health problems, and he invented this weaving machine. But when he was growing up, he had to drop out of class fourth or whatever it is to help his parents, and he didn't pursue his education. But he observed, he observed rice mills, he observed fans, how fans work, and he did a lot of observation and made this in weaving machine, which is quite popular in the Pochampalli saris. I don't know if you know about it, but they're made in Telangana in India. And but think what he could have done if he had more education. He could have done much more things for the society, and solved a lot of local problems. For many children who do not have access to education, it is because of inequality and marginalized. They're all people who are weaving these saris were all debt-ridden, a lot of suicides as well. Malaysian's own family, for example, I think his uncle, aunt, children, everyone committed suicide because of debt. And it is a huge problem. And if only there was a mechanism to take care of their health care, of their education. They didn't have to think too much about the children. Things could have been different, and they could have, education could have improved. More innovations could have, the society and community could have benefited from more innovations as a result of education. And obviously the parents won't be debt ridden. If you have better healthcare, the parents won't be debt ridden. So it's all connected again. So in but in developing and developed countries alike, children do not have access to basic education because of inequalities that originate in many things, health, sex, cultural identity, economic stratum, whatever. And these children find themselves on the margins of the education system and do not benefit from learning that is vital to their intellectual and social development. Okay. And factors linked to poverty, such as unemployment, illness, illiteracy of parents, multiply the risk of non-schooling, um, and the dropout rates. So many children from disadvantaged backgrounds, as I was saying, like Malaysian, of course, he prospered later. He invented that weaving machine, but they're forced to abandon their education due to health problems or economic problems or whatever. There's not enough support. You need to provide support to the family because he had to work to provide support to the family. So in order to work and provide support for the family, he had to drop out of school. That's one problem. And then there is the financial deficit of developing countries. Universal primary education is a major issue. Of course, India has a universal education thing, but many emerging countries do not appropriate the financial resources necessary to create schools, provide schooling materials. I mean, it was a huge problem during COVID when people in cities had online stuff, but people in villages didn't. And equally, there is a lack of lack of financial resources has an effect on the quality of teaching, right? So teachers do not benefit from basic teacher training in schools. There are not enough, and there are oversized classes. So this overflow leads to classes where many different educational levels are forced to sit together, and it doesn't help an individual child to prosper, and the education is not adapted to their needs, right? So this is a problem. And the most affected regions, as a result of poverty and marginalization, more than 72 million children around the world remain unschooled. Big problem in sub-Saharan Africa, South Asia, including India. These are the most affected countries. Additionally, there's also continuing problems of educational poverty, and extreme educational poverty, which is educational poverty is in a child in education for less than 4 years. Extreme educational poverty is a child in education for less than 2 years. So if many people, of course, might especially sub-Saharan Africa, and some rural belts in in Southern Asia as well, it's a huge problem. So the lack of schooling, poor education, it has negative effects on the population and country. Children leave school without having acquired the basics. It greatly impedes the social and economic development of these countries, right? India wants to become an economic powerhouse, but we can't ignore the well-being of the country, the health and well-being of the country. And I do feel the health and well-being is rooted in better education. So again, education is very, very important. Better education, you learn to access better healthcare. You learn to do things which are more environmentally friendly. For example, you can do more environmentally friendly agriculture. If you're not educated well, then you're not going to be aware of better environmental practices in agriculture. If you're not educated, then you won't know how diseases can be prevented by managing pollution, right? So all of this needs education. So again, a question. I just want to pose this last challenge. Had one more challenge in mind on democracy, but we'll have to drop that in because I'm conscious of time. So only 44% of all students in government schools in class 5 in India are able to read a class 2 text. The situation is worse for numeracy. Only 22.7% of all students in government schools in class 5 are able to do division. India has been in the midst of a learning crisis for a long time now. In UP, teachers enjoy a higher standard of living than most people, roughly 10 times the per capita GDP in the state. Teachers get good money. But this may be the root of the problem. So, this is according to Esther Duflo, the guys who got the Nobel Prize. Such a high pay could be counterproductive, attracting the wrong kind of people, as there is no obvious reward for performance, and children are promoted automatically. Yeah. Okay. They're automatically progress, they're not learning. Okay. Um, and then we have the Baijus, whose former salespeople say the company pushed its products on parents who can't afford them. How can child learning be improved and affordable? That's my question to everyone in this forum. So, any solutions, any ideas, please throw them. And let's have a little discussion as well. Anyone wants to
So
present?
I don't
Yeah.
have any ideas, but I feel that education is one such thing that all of us together, as people who are privileged enough to have that education, should be willing to share it with people, because that is not something that any amount of investment can result in, like unlike infrastructure or anything like that, where it is man-made, and we can put people uh, to make it, and then it can stay. However, education is not something like that. People need to actually willingly and actively contribute to this cause. Only then the situations can improve. So I feel that more and more youth has to be encouraged into sharing and into providing themselves for the people that cannot provide for themselves.
See, talking more about volunteering, Shagun. Shagun, is it more about
Yes,
volunteering efforts? Yeah.
yes, sir.
Okay. So, how would that? So when we talk about volunteering, is it Hi everyone, apologies. Something happened and I went out of the call. Is everyone still here?
Yes, sir.
Yes, sir.
Hi. I something happened. I don't know what happened. Yeah. So Shagun, you were saying we need more volunteering efforts.
Yes, sir. Yeah, so this could be done even through corporates, like trying to devote some amount from their employees' time to kind of help the people out, or even
Yeah.
private schools could partner with government schools, where children from
Mhm.
these private schools could actually spend even 1 hour of their lecture time to help these kids out, and I think that could make a difference, given that
Yes.
we have so much. The biggest advantage is that we are very rich in numbers in terms of number of people that we have,
Yeah,
So I think human capital can always be used at its best.
yeah, definitely. Yeah, I mean that's absolutely an important way of thinking. But I mean, I do feel that there is. I don't know if this is everyone agrees with this thinking of mine, but I do feel, for example, having watching Kota Factory, for example, or of course, I grew up with Agrawals and Brilliance when I was a child. Um, but I do feel there is more stress on the aspirational higher education. So, like, um, of course, that's mostly privatized as well, isn't it? A lot of the engineering, medical education is privatized in India, and there is more um, infrastructure resources being poured into, because it's not, we need to have more focus on primary education. Instead, what is happening is, um, we, we don't need everyone obviously to graduate. That's not what we need. We don't want everyone to have a university degree, but at least people should be educated decently in their primary education, right? So in my opinion, there's a lot more emphasis on the aspirational stuff. Like a lot of my cousins who grew up in villages in India, they all the parents forced them to actually become engineer, doctor, whatever, and then go and secure a software job within the city. So there's the aspirational element. Again, this can only be met by, even in villages there'll be a few rich farmers, right? And few well-off farmers who have lots more land than other farmers, most people. So only they can meet these kinds of needs. So what will, I mean, if this thinking persists, in my opinion, primary education will be neglected, because because there'll be a lot more focus on building these tertiary education, or further education, or higher education kind of infrastructure, at the cost of, we always keep talking about, we need more IITs, more IIMs, we need more, better higher educational institutions. But do we really need so many graduates? Does everyone have to become a graduate in the society? If, I'm not sure about it. Can we take some of that energy, some of that? It's not, some of that energy, and actually invest that energy in infrastructure and the resources into more better primary education, then the whole country will be well off, in my opinion. Again, it's a reflection. I don't know how many of you agree with it, but I just thought I'd put my point across. Obviously, we're all, I'm university trained, and you're all in university. But that's a different story. But it's easier for us sitting in this forum and debating about it. But again, the fact is, without education, I don't think many of us would be thinking um, about these problems, isn't it? In the first instance, why do these problems? Now, we need to give at least some of that reflection, that thinking ability, to most people in the country, so that as a whole the country can be better. This is where education is important. Now, if your education is stuck in class 2 and you can't even do basic subtraction, how can you reflect more on the larger problems affecting you, right? Okay, so that is my opinion. That's my thinking. How many? I mean, what do you think, Shagun, on that?
Yes, sir, I completely agree with you on this point, because I feel that education is the basis of a lot of things, and for anything, or for any person to prosper, I feel that they must know the basics of getting forward, and then eventually resulting into all other things.
Absolutely, absolutely. Right. Okay. So I have one more. I don't know if we have 15 more minutes. Is Dr. Jaising here? Dr. Jaising?
So, I think his network connection, sir, may not be there. Yes, I'm Sabiha. Tell me, sir.
Hi, Sabiha. Yeah. Do you think we have enough time? I mean, I have one more challenge, which is democracy. I think we have 15 minutes, isn't it, remaining?
Oh, sir. So I believe, I'm sorry. How long would that take? Because it's 3:30 now, and we're
Yeah,
scheduled till 3:45.
45. Yeah. I think maybe students might be exhausted with all the reflection and thinking as well. So
I was thinking.
yeah, we can carry on in the next week when of course, there's a lot more discussion and there'll be a lot more analytics next week when we do technology entrepreneurship.
Right. Right.
But when we do technology entrepreneurship, we'll do technology democratization. And at that point, we can discuss democracy and institutions as
The
well.
next week's topic, next week's discussion.
Yeah, we'll move it to next week, along with technology entrepreneurship.
Technology, exactly the topic for that day.
Yeah.
Right.
Yeah.
Sure. Yeah.
Brilliant. Thanks, Sabiha. Thank you so much. Thanks to all the students for participating and throwing your ideas. You've been very helpful, because without you, this seminar wouldn't have happened. So thanks so much for contributing your ideas. I hope you carried away a few things from this seminar.
We definitely did, sir.
Thank you. Have a nice day, everyone.
Thank you so much, sir.
Thank you so much, sir.
Thank you, sir.
Thank you,
Right.
sir.
See you all
Do
next
we
week.
have anybody who's taken the screenshot, students? Placement cell?
Yes, ma'am.
You have, right? Okay,
Yes, ma'am.
great. Yes, sir. So we are going to continue this next week, and it was so lovely to have you again.
Thank you, Sabiha. Thank you so much.
Yeah. Thank you.
Yeah.
Thank you. Most
See you
welcome.
next
Thank you, sir.
week. Bye. Bye.